Dr. Christy Ennis. If you are tired of having back pain, you need these exercises in your life. Today we're working on all the muscles that help support that spine, so everything around there. And don't worry if you're just starting out or if you're in an advanced level, I'm going to give you modifications so that they work for everybody. For this first one, I'm obviously on the floor, but if it bothers your back or any other part of your body to be on the floor, you can totally do this in bed. So this is actually going to be a bridge variation. So we're going to start by bringing our feet about hip width apart. I'm actually going to press my elbows down into the floor, and this is an important part of this exercise. If you can, you're going to do a little pelvic tuck, only if it doesn't hurt your back, again, or any other body part, just to help engage actually in through those glutes. So arms are up like this. I'm going to press my elbows in as I lift my hips up. I'm only lifting as high as I can without arching through any part of that spine, right? Rib cage included. The elbow dig here really helps because now we're activating the lat muscles as well. So we're getting the glutes from below, the lats from above, and it basically just surrounds that back and really gives us that nice support and stability. To make that one a little bit harder, you can do this with single leg. So I've got one leg up in the air, elbows are going to dig again, same idea lifting that butt, but now only one side is actually doing the work. And then to make it even harder than that, if you put both feet back down again, come up into that bridge, stay with that elbow dig, and then add that little march. This is actually harder than that single leg. You really have to work on keeping those hips stabilized here. So shoot for 10 to 15 for any of those variations. Staying right on that back to target those deep abdominals for this next one. I usually have people put their hands on their hips so they can make sure everything stays even. You're going to think about bringing that belly button in towards that spine a little bit. So it's like you have maybe a little bit of a tight pair of pants on, but not like Thanksgiving Day, full, just a little full. From there, you want to make sure you're in a happy, comfortable back position. So this doesn't necessarily mean you're flattening your back to the ground. It's wherever your back feels like it wants to be, right? We all have different positions of our back. Some people's backs are arched, some people's are flatter. So find what position's comfortable for you, and that's your starting position. All right, so hands on the hips, you're activating in through those deep abs, and then we're adding just a tiny little march. Now, as I'm doing this, I'm really concentrating on making sure that my hips aren't wobbling side to side. That's why I've got my hands on my hips here. And then I've got that belly button still pulled in, and obviously I'm breathing, right? I'll make people talk to each other, then they know for sure whether they're breathing or not. Your goal is to do about 20, but if you find that you lose that position, stop wherever you're at, reset, and if you can't re-get that position, then you're done for the day. When we have back pain for over 30 days, specific muscles actually start to shut down, including those deep abdominals and those glutes. So it's not even necessarily a matter of strength, it's a matter of retraining and getting the brain, the hardest part, right, to talk to those muscles again. To make that one a little bit harder, you can add some arm motion too. So start with both arms pointing towards the ceiling. My left arm is going to go back as my right leg goes out. So it's kind of a modified dead bug or struggling turtle, as I had a patient name this. You can even just stick with that march if you don't want to do that straight leg. It does take coordination too here to do this one. Notice I almost messed that up. To make it even harder, you can bring both those legs up into the air. But I do caution you on this because oftentimes I'll see people arch their back or push out their bellies as they get into this position. So if you do either of those things, you're not ready for those legs to be up in the air yet. So same idea, you can go ahead and start with just like a little toe tap and a march, or you can go with that straight leg. Obviously the straight leg is a little bit harder, so you can work up to getting that straight leg. Okay, you can stay in your comfy bed, but you do need to flip to your side for this one. We're getting all of these muscles along the side of the hip, which again helps support that back too. So lying directly on your side, put something underneath your hip if you need to for extra cushion, because you don't want to roll back with this one. You're going to look down at your feet and your legs. You should be able to see your feet, but not much of your leg. If you see a lot of your leg, that typically means your legs are way too far forward, and we're going to be using those front hip flexors more than those side glutes. You can bend the bottom leg if that's more comfortable for you. You're going to keep your torso lifted just a little bit, ever so slightly, away from the mat. As I always say, pretend your cupcake is there, or whatever favorite food you've got. Mine are also nachos and pizza and cheeseburgers. And then you're going to take this top leg, you're going to aim back towards that heel. Turning that toe down just slightly, as long as it feels okay, activates these side glute muscles even more. And you're going to come down and then you're going to come up. Notice I'm not coming up super duper high, otherwise I'm going to lose that muscle activation that I'm gaining there as well. You can always err on the side of bringing that leg back a little bit more so than forward. So it might feel like, yeah, I am bringing that leg back a little bit. That way you'll use, again, these muscles that we really want to be using much more than those hip flexors, which tend to be kind of strong and tight anyways and tend to make that back even worse. So let's get those muscles working that we want to. Again, typically about 15 to 20, but you're stopping if you start to feel a little bit of fatigue or, of course, if there's any pain. We're working until we get a little bit of tiredness going in that leg, and that might vary from person to person, and do make sure that you do both sides. All right, we're getting the whole side of this body. So those side hip muscles and some of those obliques and that quadratus, one of those back muscles. So the easier version of this, or kind of the midway version, is with those knees bent. We're still in a nice straight line. I'm propped up on my arm. We're gonna think about lifting from that lower body. You're going to use your arm, of course, as you lift up, but really try to put your effort and your energy right into that lower body, right? Where energy flows, where focus goes. It's really true. So 10 to 15 here if you can. And again, if you want to make this one actually a little bit harder this time, you're going to straighten those legs out. So longer lever arm means you have more to lift. Same concept though. We want to stay in that nice straight line. Try to avoid rolling forward as you do this. And if you really want to go extra hard, you can add a little bit of the one that we just did to this one. So it's that side plank and leg lift. This one is tough. You can always back it down a little bit by bending that bottom knee. Whoops, I almost brought that leg too far forward. Good example of what not to do. And then I'm also going to show you a way to make this a little bit easier. So to make this one a little easier, we're taking it off the ground. So same idea that we're going to dip down and push up, really concentrating on using the side of the body, not the arm. So the higher up you are, the easier it is. The lower you are, the harder it is. So if you need something in between, you could always use your bed or something like a counter, but same idea, same repetition. All right, last one is on the hands and knees. We're gonna get those smaller muscles in the back this time. So try to stack those shoulders right over those hands. Again, always thinking about engaging in through those abdominal muscles, keeping a nice flat back, no arching as we do this one. And you're gonna take opposite arm and leg and come out. So this is kind of the moderate level. You can stay on one side as you're starting. Sometimes that's easier than alternating. And then I'll have people alternate as they get a little bit better. Watch as you're doing this though, especially with the alternating, that you're not dipping or arching into that spine. And it's a gentle squeeze in those shoulder blades too. Now, if that's too much to start, especially if you're having difficulty holding that position, I'll start people with just a little toe tap behind. So we're leaving the hands on the ground to add another base of stability or another point of stability. So this is a little bit easier to stabilize. You can even go ahead and just do the arm. Right? And then you can work on adding them together. To make it harder, if you go ahead and add in that, again, same move, and then you're gonna bring that arm and leg out to the side. So you have to stabilize through that core even more as you're adding more movement in. And again, for this one, I usually do stay on the same side. So shoot for about 10 to 15 on each side.